Hospitals in Calgary are dealing with a flood of E. coli infections linked to daycares. There are 128 confirmed cases so far. Dozens of them are children being treated at hospital. Let's bring in Sarah Galashan, who's updating this story for us. So, Sarah, what's the latest?
Well, Hannah, as you say, 128 cases. That's the last number that we were given by the Alberta Health Services, and we are anticipating there could be an update later today. All of these cases linked to 11 daycares, and those daycares, as a result of this outbreak, have been ordered to be closed. And possibly in that next communication that we receive, we might get some intel as to for how long the daycares will remain closed because of this. What we know is that all of these daycares shared a centralized kitchen. The outbreak was declared 4 days ago on Monday of this week, and since then the number of cases has risen. Of the 128 that we have confirmed, there are 25 of them in hospital. The majority of those cases in the Alberta Children's Hospital, but 5 of them are being treated at the Peter Lougheed Centre's pediatric unit. There are 3 cases that Alberta Health Services has confirmed are being treated out of province, but they are linked to this daycare outbreak. And of those that are hospitalized, 9 cases are confirmed to have developed HUS. HUS stands for hemolytic uremic syndrome, and this is a syndrome that affects kidney function and can, in severe cases, lead to dialysis. And that's why in some of these cases in this Calgary outbreak, the children are having to be monitored very closely. And CBC earlier today spoke with a specialist explaining the need for monitoring closely these situations.
You know, we get them to do daily blood work. That's a lot of work because there's no one particular test that you can do to detect HUS. You know, it is this insidious kind of development of multiple symptoms and signs. So you want to watch their red blood cells and their platelets and their kidney function, and you have to do it in a serial way. So they have to watch it. That's why it's done every day so that we can catch this as soon as possible.
So what are the chances we are going to see the number of infections increase?
We certainly have been seeing them increase throughout the week, Hannah. As I say, it was declared an outbreak on Monday, September 4th. And at that time, we had 17 lab-confirmed cases. There were another 12 cases that were in hospital and 50 that were presenting symptoms. By yesterday, there were 128 confirmed cases. Then there have been updates coming from AHS regularly throughout the week. The infection can present within 10 days of ingesting bacteria, most commonly on contaminated food. And in other words, you can have a person who has ingested this bacteria seeming well and then suddenly developing symptoms, which are most commonly severe stomach cramping, bloody diarrhea. Most patients will recover from this without hospital treatment or hospital care within 10 days of the infection. But antibiotics, anti-diarrhea drugs, that's not recommended in terms of any treatment here. In the case of the daycare outbreak, a dedicated clinic, in fact, at Alberta Children's Hospital has been set up for parents who take their children to emergency. Post that emergency visit, they then can go to the clinic and they would be monitored closely throughout to ensure that they are recovering.
Sarah, thank you for the latest on this. For more on this story, I want to welcome to the program Stephen Friedman. He's a professor of pediatrics and emergency medicine at the University of Calgary Cummings School of Medicine. He is also a pediatric emergency medicine physician at the Alberta Children's Hospital. Welcome to the show.
Hi, good afternoon.
We were just talking about this story. Should we expect the number of cases to grow?
Well, we do anticipate the total number of children diagnosed with this infection to continue to grow. You know, we've seen many children with the symptoms of infection who we've tested and collected stool on, and we're waiting for those results. So many of those children are still undergoing treatment while we're still awaiting confirmation of their result. However, most of the exposure presumably happened prior to September 1st, and most exposed children should develop symptoms within 10 days of that. So hopefully we are getting towards the end of new cases presenting. However, there's also always the risk of secondary transmission. So approximately 10% of household contacts of children with Shiga toxin-producing E. coli infections will become infected themselves, and so they can also develop symptoms, and so we're going to be monitoring closely for that over the subsequent 2 weeks or so.
So that looks like if it was September 1st, that would be September 11th, and then a couple of weeks in total that you'll look for all of these cases?
Well, we hope. So presumably the source of infection has been eliminated. So there are no new exposures happening after the daycares were closed. And so if we assume that most children are symptomatic and presenting prior to September 11th, any children exposed to those individuals will hopefully present in the subsequent 10 days following that. So hopefully we won't see any new cases at all after September 20th, and hopefully the numbers even dwindle as we go into this weekend and into next week.
Let's talk about the direct source of infection. How does that happen?
So the bacteria, Shiga toxin-producing E. coli, also called S-tech, it's a commensal or a normal bacterial that is carried by cattle. So cows will shed it in their stool. It then goes into kind of groundwater, soil, can contaminate produce, that is particularly those that are grown on the ground. But in addition, it can contaminate meat during the slaughter process. So if these contaminated foods then go to a grocery store, are brought home, if they are either not washed very well in the case of fruits and vegetables, or if they're not cooked thoroughly in the case of beef, the bacteria that, if it is present, would not have been eliminated, and then it's ingested by an individual who then becomes infected. And then the secondary cases happen because the individuals who are infected can shed it in their stool, and then unfortunately due to inadequate hand hygiene in the household, that can then be transmitted. So one of the big things that we're stressing recurrently is the importance of hand hygiene in the households of infected children.
What are the initial symptoms of an E. coli infection?
So, the first day or two starts off like any other type of diarrheal gastroenteric infection. So just runny, watery diarrhea, but then they start to develop severe cramps. And then the vast majority of children infected with this type of Shiga toxin producing E. coli develop bloody diarrhea, approximately 80% of the time. And so those are the early symptoms. The bloody diarrhea lasts for another 2 or 3 days and typically starts to abate and go away. However, while they're having the diarrhea, the Shiga toxin E. coli secretes a toxin that can go into the bloodstream. And it's after that the toxin goes into the bloodstream, when the diarrhea starts to resolve, that we then start to see it have effect on the end organs and the microvasculature, the blood vessels, which lead to the complications called the hemolytic uremic syndrome, or HUS, which is really the biggest concerning feature of this infection. So while the acute infection is very troublesome, uncomfortable, unpleasant, and children can become dehydrated, that can all easily be treated. It's the hemolytic uremic syndrome and its associated complications that is much more worrisome.
What are those complications?
Sure. So about 10 to 20% of children with Shiga toxin producing E. coli infections such as this one can develop the hemolytic uremic syndrome. About half of those children go on to require dialysis. The vast majority of those children need red blood cell transfusions because they develop anemia. And then because of the way the hemolytic uremic syndrome manifests, it really affects the small blood vessels. And so it can cause these symptoms of occlusion of small blood vessels anywhere in the body. So including the brain, the heart, pancreas, liver, et cetera, in addition to the kidneys, which is the most common organism. So depending on the other organs involved, the symptoms will be unique and specific to that child. While we can easily support children who develop renal failure through dialysis, it is most important that we hopefully don't have children develop the other complications that can be much more troublesome to treat.
Oh my gosh, that sounds so scary. What would your message to parents be?
So I think my message to parents is, number one, the vast majority of children, so 80 to 90% of children, do not develop the hemolytic uremic syndrome. But because it is very insidious, we do monitor children very closely. So really supporting the monitoring, maintaining hydration, and coming to the hospital, receiving IV fluids until we feel that your child is no longer at risk for developing the hemolytic uremic syndrome is really, really important. Should they develop complications, we tend to admit these children very early, which is why we're monitoring them very closely. And we really do everything that we can to prevent secondary complications and then treat those complications should they ensue, really. And that's part of the reason why we keep most of these children in the hospital, especially if they don't yet require dialysis or other specific treatments, because unfortunately there is no specific treatment for this infection. And in fact, as was noted earlier, antibiotics are really avoided in this infection because they can actually increase the risk of developing the hemolytic uremic syndrome.
So 128 cases so far. This is the biggest number of cases, correct, of this type of outbreak?
So this seems to be probably the largest single point, so single source outbreak in children under 5 years of age reported. There have been larger Shiga toxin E. coli outbreaks. There was a very, very large one in Europe approximately 10 years ago, but that affected predominantly adults. And so this is a unique one where it's affected really the youngest children. And it should be noted, children under 5 years of age are at the highest risk of developing complications from STEC or Shiga toxin producing E. coli infection. So as children get older, the risk of developing HUS decreases. But in the youngest kids, the risk is approximately and can approach 20%, which is really why this is quite a concerning event in this case.
I'm going to have to leave it there, but thank you for all this information, so vital. Stephen Friedman, he is a professor of pediatrics and emergency medicine at the University of Calgary, as well as a pediatric emergency medicine physician at the Alberta Children's Hospital. Thank you kindly.
Pleasure.